Marina. And we were laughing beforehand. She really doesn't need an introduction for those of us who've been regulars, because she's been with us for quite a while now. But if you read the description, you know she's going to talk to us about health as business owners, and that's why this icebreaker, sort of tied into it. So, as a business owner, you know already that health is not just essential to happiness, but it's also essential to the success of your business and ultimately your bottom line. Because if you're not healthy, you're not able to do what you do, and therefore you're not able to bring in prosperity. So it's also easy for us to brush off the symptoms that we have as, oh, I'm just under a lot of stress, or I'm getting older. And by the way, don't try that one with me. Don't try that one with Stephanie. Okay, because we both work out at the same place, do strength training, and it's all about, we're pushing those boundaries as far out as we can. So stick around. But if you feel like that, your thinking isn't as clear as it used to be, anybody ever feel that way? Today's one of those days that I've been kind of worrying about that. Or you wake up tired and you can't move until you've had your caffeine, right? Or you have trouble making decisions and, it's like there's brain fog going on. Or if you can't get a good night's sleep, which contributes to brain fog, of course. Or you don't have the drive and the motivation that you think you used to have or that you would like to have. So Marina's here to tell us that there is good news about this, and it could be your biochemistry that's getting in the way, and it's not age. Stress certainly plays into your biochemistry, right? But it's not your age that's to blame. And so she's going to tell us about some leading edge tools to help you restore health to your body and to your bottom line. Now, she has been a health practitioner for some time, but now she considers herself a health detective. And I like that. That's a really nice, I wish I had a nice zippy line like that, right? She uses the principles of functional medicine to help people get well and stay well. And she uses specialized lab tests to look at the underlying imbalances and then figure out what to do to fix those, including food, herbs, enzymes, and homeopathy. So if you don't know anything about some of those, you're going to learn a little bit today. And she specializes in mood and energy, joint pain, hormones, and digestion. And if there's anybody in the room who hasn't had a problem with at least one of those, I'd be very surprised. So she is going to tell us about a sort of poster client that she helped, and I think you're going to find that fascinating. So I'm now going to turn it over to Marina so we can hear what she has to say on the topic. Help me welcome Marina.
Thank you. IT support. Is there anything else I need to do to get that to come on?
I just push the button twice.
It's coming.
Sylvia, maybe you can turn these lights off. That might help. Yeah.
It'll get brighter in about a minute.
It'll brighten up, right?
Yeah.
Yes, it sure will. Like magic.
So thank you all for being here. It's been a great group. So today we're going to talk about how to turn your health into your #1 business asset. So some of you had great sentences to say this morning in your introduction. Health is wealth, right? Without your health, you don't have much, right? As a small business owner, you are your business. So there are lots of reasons why you don't want to be unhealthy. For some small business owners, it's that they don't even want to be diagnosed because it will affect their insurance, right? So a particular reason that doesn't even have anything to do with their function. Okay, so what's our mission today? So we're going to demystify the steps to having your health be your #1 asset. And this is kind of what I've figured out in my years of practice, is that really what I'm doing is I'm a health detective. I'm helping people uncover really the root cause of what's happening underneath, especially when they've been to multiple specialists. They might multiple diagnoses and be on or prescribed multiple medications. And it turns out that there's actually a common root cause. That's perfect timing, isn't it? Okay, so this is the part where I'm going to ask for audience participation. So what gets in the way? What are the symptoms that you have, or your friends, or your family, or your clients, that you know sometimes interfere with your business?
Unable to sleep.
Unable to sleep. So you're tired. What other symptoms do you have, or do your friends and family have?
Big demystifier, stress.
Stress. Okay, and what does that show up like?
Actually, you said you. I was speaking of my client, so the question was me or my client.
Right.
Okay.
And if you don't want to have it be too revealing about you personally, it's fine.
Okay.
Your friends, your family, your client. What are some symptoms that get in the way?
Well, allergies would have it.
Allergies, sneezing, sniffling, can't think clearly. What else?
Poor digestion.
Yeah.
Poor digestion, gas, bloating, having to run to the bathroom, just feeling uncomfortable all the time. What else?
Headaches.
Headaches. Oh yeah, it's really hard to think straight when you have pain in your head.
Backache.
Backache. Did you guys read ahead?
There's
one
You
back
asked
here.
the right question.
Expectations.
Expectations. Expecting yourself to be functioning better. One more. What other symptom can get in the way of you functioning through your day? And
Food intolerance.
food intolerance. So what does that
Food
show up like?
sensitivity.
Food sensitivity.
Yeah.
Yeah.
Can't eat this, can't eat that.
So it turns out that these are the top 8 reasons
We missed the back page.
that people seek alternative health care. For every 1 visit to a conventional doctor, there are 4 visits to an alternative practitioner for these symptoms. And what does that tell you? Conventional medicine doesn't have the answer, right? Because if they did, people wouldn't be looking elsewhere. So these are very common symptoms. And of course they interfere with your function. Anxiety, depression, back pain, headache. I'd say you made a pretty good dent in that list. Okay, so how do we explain it? Because everybody that comes into my office has an explanation for why their back hurts, or why their joints hurt, or why they have indigestion, or why they're not sleeping. So the biggest one is stress, right? Well, I just get this headache because I'm under stress. Well, I can't digest my food well because it's stress. Or it's genetic. This runs in my family. My family has heart disease. My family has diabetes. Or your spouse. Right? My spouse snores. I can't sleep at night. Or my kids are driving me crazy. Or work, right? I have a pile of work to do. I just don't have time to do other things. And my favorite one is old age. Because most of the people that are complaining of old age are younger than I am. I mean, seriously, I have people in their 30s saying, well, I guess this is just what it's like to get old. Isn't that crazy? But we all do that. We all have explanations for why we don't feel good. So the one about old age, I'm going to tell you my client, my $1 million business owner client, was explaining why he wasn't functioning well in old age. I'll tell you the story later. And then trauma. I want to tell you a really graphic example of how somebody had an explanation for why they were feeling bad. I had a woman come in to see me who was a beautiful, tall, blonde, well-dressed real estate agent in Los Altos. And she came in with a complaint of fecal incontinence. That means she didn't have control over her bowels. So that was pretty dramatic. I'd never seen that before, right? So I said, well, how long has this been a problem? Since the birth of my son, because there was trauma in labor and delivery. So I've had this problem ever since. I said, wow, how old is your son? 15. So she had a reason. She had a very valid explanation for why things weren't working for her. But when we did an evaluation and found out what her underlying biochemistry was doing, it took 2 weeks for the problem to go away. It never came back. It's been 7 years. So even when you have stress, and you have a genetic history, and your spouse is snoring and your kids are driving you crazy, it doesn't mean you have to have the symptom that you have.
What if you have all of those at the same time?
It happens, doesn't it? So before we dive into the heart of the matter, let me just tell you a little bit about me and who I am, where I come from. So I am trained as a chiropractor, also a certified clinical nutritionist. I was an instructor at Palmer College of Chiropractic, which is kind of the brand name of chiropractic schools. I was in private practice in Los Altos for 12 years. And then I had the opportunity to actually teach practitioners, to teach health providers. So I did that for 4 years, traveling around the country, being a speaker and coach to healthcare providers. Because I want to have a larger impact, because so many people come in and say, oh my God, why didn't I know this sooner? Why didn't my doctor tell me this? I wish I'd met you earlier. And that's kind of heartbreaking. So now, what am I doing in my life? I told you I would show you a picture. So last year I bought a house in Redwood City, and I did my own, I was my own general contractor, gutted the kitchen and the bathroom. I mostly did that because I didn't know what I was getting into, but there's my new kitchen. It's all done.
Wow.
And I completed it in 2 months.
Wow.
So I probably didn't have realistic expectations, you know, like I didn't know that these things drag on for years for people. I just wanted to get it done, so I did, got it done. I'm also returning to private practice starting January, so a couple months ago. And this is my new website.
Yay.
Thanks
Nice.
to Bill and Kevin. So I'm blogging and focusing on doing more of a web-based education model, because what I was doing before, people were flying in to see me, or I was flying to teach seminars. And now I want to do it so that people can learn from the comfort of their home. So yeah, check out my website.
What's the website? I didn't see it up there.
It's drmarinarose.com.
Thank you.
So my life wasn't always that way. So about 8 years ago, I went up in a hot air balloon, and we had a crash landing. It wasn't horrible. There was no broken bones. There wasn't even anything that would send anybody to an emergency room. Except later that night, I ended up in urgent care with what was diagnosed as a bladder infection. Within 8 months, I was diagnosed with degenerative discs, arthritis, sciatica, interstitial cystitis. Wow. If anybody knows what that condition
Yes,
is,
it's
it's horrifying. Depression, of course, irritable bowel, and an incurable condition that prevents normal life by a world-renowned specialist at Stanford. So I had reasons, right? So you talk about blaming your health conditions on your spouse or your job or stress. You know, those are the reasons that keep you from being healthy. I had reasons that I couldn't be healthy. And it looked like my life was going in a different direction than health. I was a healthcare provider at the time. I was helping people with those conditions. But there was something that I was missing. And I dove into doing research. And I figured it out myself with the help of some experts, but it took me 8 months to figure it out. I don't want that to happen to anyone else. So what I discovered was that even the intervention for what was diagnosed as a bladder infection, turns out it wasn't, caused the spiral of additional problems. And being trained as a chiropractor, what do chiropractors believe? The body heals itself. It's true, it does. But when you have heroic interventions, it can throw the balance off so severely that the body doesn't heal itself, it doesn't recover. So, what do you do? How do you decide? How do you figure it out? How do you know who to trust? When you're looking at all of your options for healthcare, diet, what's the right thing to do? Should I become a vegetarian? There's a lot of benefit to becoming a vegetarian, right? I can find all these experts that say vegetarian is the way to do it. What about the paleo diet? Has anybody heard of the paleo diet?
Yeah.
Eat a lot of meat and fat. That's the thing to do. That's what our ancestors did. That's what the caveman diet was. Okay, I might need technical support. Can somebody tell me how to get that back?
I'm not a Mac person.
Okay, it's back on my computer, but it's not back on the screen. I think I might have hit a button.
I have a hammer if you
Let's talk about that paleo diet some more.
need. Yeah.
It was coming back a second ago.
Can I give that to you and make that?
Backyard. So I'm suspecting on here, there's a way of saying,
I probably hit a button by mistake.
yeah. But I
It did come back for a minute, right?
it a
Do you know
Mac?
how you would hook up another monitor? if you
Yes.
wanted to?
Did it,
I used to be able to.
there was something.
Are you a Mac guy? Yeah.
There you go.
Yay!
Wow.
Yay, Eli.
Thank you.
Okay, I have your and then slideshow.
Oh, wait.
Yeah, there we go.
Yay! Yes,
May I just clarify?
yes.
You mentioned that you had an accident, and then within a certain period of time
Yeah.
after the accident, you were diagnosed with a condition.
Right.
You were treated for the condition.
I wasn't treated for the condition. Pretty much I was told, this isn't gonna get better.
Okay. And then you developed all those other.
And they,
Secondary.
so they were all different specialists, right? So I had an MRI, and somebody diagnosed me with degenerative disc, it's causing sciatica, and somebody else diagnosed me with this, and somebody else, and then I went to, Stanford specialist. So that's very common in the medical field.
Yes.
Yeah.
And I knew that because I'm in healthcare.
How was it related to the balloon accident?
It's a long story.
Okay, all right.
So it was, sometimes the triggers are small. It can be a car accident, it can be an antibiotic for a cold, and the additional interventions are what cause the additional problems, yes.
Well, being, a chiropractor in the healthcare profession, why did you go from there to the medical doctors and have the MRI?
Because when
What
you're,
prompted you?
sorry to be so graphic, but when you're peeing blood, that's not something that I count as being okay to treat alternatively.
Okay, so
especially
you saw
because-
something else
Right.
and said, I
Right.
need to do that, okay.
So those 10 types of things are kind of what those heroic measures are for.
Mhm.
But, so I'm not saying don't go to a hospital or don't go to a
Yeah.
medical doctor. It's kind of a cliche, but some of my best friends are doctors. But we have to recognize that you pay a price. And that's what many people are missing, and they don't know how to find that price. They don't know how to find that imbalance. And so that's what I focused on, because there is so much information out there. How do you know what supplements you need? Do you take vitamin C for your immune system? Oh no, that actually increases your risk of problems. Well, what about vitamin D? Is vitamin D really a hormone? Is it a vitamin or is it a hormone, right? I don't know if you've even heard of these types of things, but there's always new information coming out. So how do you decide? What about the Atkins diet, the South Beach diet? What do? How do you find information you can trust that's specific to you, not your condition or your symptom or your stress? So I want to tell you about another patient, a woman that came in to see me last year. So last year I was just kind of seeing friends and neighbors. I wasn't officially in practice. So this woman was tired. Every afternoon she wanted a nap. She was hungry all the time, but used her willpower to control it and make good choices. She's having trouble sleeping. There was something else I can't even remember right now. So I took a history, I looked at her diet. She was doing everything right. She was exercising 5 times a week, eating vegetables, whole grains, limited amount of animal protein. She was literally doing everything right. So why wasn't she healthy? Why wasn't she feeling great? Where was her energy? Well, when we looked at her history, it turned out that about 6 years ago, she'd had a major stress in her life, and it started at that time. Her adrenal glands were really out of balance, and when we put her on a really targeted, specific supplement plan, her symptoms improved dramatically. She's probably almost old enough to be my mother, and she exercises with her son on a regular basis now. So she was doing everything right, but her body was out of balance in a way that it couldn't recover from on its own. Now I'm going to see if I can show you a video from Dr. Oz. How many people have heard of Dr. Oz?
Everybody has.
Everybody's
He's
heard
got
of
a great name.
Yeah, he
Everybody
has.
does.
With the vibe.
Oh my goodness.
it. Worst advice I've ever seen on TV.
It's a 4-minute video, and it sums up really well a really important missing piece for a lot of people.